Hello and welcome to another episode of Art of Impact. On this episode, I had the chance to speak with Dr. Abdu Sharkawy, an infectious disease specialist at the University Health Network Hospital here in Toronto. Dr. Sharkawy is also an assistant professor in medicine at the University of Toronto. Given the recent developments with the COVID-19 pandemic, a lot of unanswered and pressing questions began circulating. And I feel as though it's important to get an insight into the uncertainty surrounding COVID-19 and how it will impact us in the coming months. That being said, during our chat, Dr. Sharkawy and I spoke about a range of topics surrounding the pandemic, including pressure on the existing healthcare system, the origins of the virus, and our current state of social distancing and why it's important. Dr. Sharkawy earlier in March actually went viral for a cautionary Facebook post about the pandemic, which garnered about 2 million shares and has since been on news channels such as CTV to share his insights. And building on that, I was very grateful to speak to him, and I hope you guys find our conversation helpful in any way. Hey, Dr. Sharkawy, thanks so much for coming onto the podcast.
Pleasure to speak. Thank you for having me.
So you're currently an infectious disease specialist at the University Health Network, and you've been in the field of medicine for a good amount of time now. And something I wanted to ask you about personally, I'm interested in this, is why you chose to study infectious disease particularly.
Where do I start? I think infectious disease is just the best possible intersection between just so many unique roles that you can fulfill as a physician. I think that there is a real emphasis on being a good clinician, noticing small clues that can really help you determine what it is that is causing a patient suffering. The fact that somebody's travel history, somebody's hobbies, somebody's lifestyle can uniquely determine what sort of disease they may have acquired and how they may be at risk for having acquired it, to me is fascinating. The fact that microbiology with these invisible microbial life forms can cause so much insult to the human body and how our immune system reacts to it, I find fascinating. I find that our ability to be able to find treatment strategies that can effectively cure a patient and bring them out of the clutches of death and literally restore them to an entirely healthy life once again is something that's extremely gratifying. I don't think that that's something you find in a lot of different subspecialties in medicine. So for all of those reasons, I find infectious disease extremely appealing on an intellectual level, on a sociological level, and at a clinical level. It really hones our ability to be good communicators, good scientists, and good doctors all at once.
That's really interesting that you say that. And one other thing that I heard and learned about regarding infectious disease, that the space itself and several facets of it are constantly developing. Is that correct?
There's no question. I mean, all you have to do is remember where we were 3 months ago, and nobody knew anything about what the SARS coronavirus was or COVID-19. If you said COVID-19, somebody would have thought that was a video game. But here we are, and we're dealing with emerging infections and evolving infections and resistant organisms. That's unfortunately our present. It's going to be our future as our society becomes more complex in terms of all kinds of things, from consumer utilization of different antimicrobial products to agro industry and how antibiotics go through that chain. This is not a problem that's going to go away anytime soon. I find it extremely challenging. I find it extremely invigorating to know that I have to be on top of things constantly, and I'm a student as much as I am a teacher.
Yeah, that's really interesting that you say that, and that you brought up COVID-19, because obviously everyone is talking about right now in our current climate. And one thing I wanted to ask you specifically, and this goes out not only to but sort of the community of doctors and infectious disease specialists like yourself. Everyone was sort of shocked or taken aback at when all of the escalations of COVID-19 and the coronavirus started to take place and seep their way into policy. But I'm wondering, what were the signs for you and your community of doctors? At what point did you realize that, okay, wow, like this might spiral out into a pandemic? And this is sort of a two-part question, where the second part is why wasn't the general public sort of aware of this, or why did they become aware of it too late, so to speak?
Yeah, those are excellent questions. And I think the simple answer is this is such a unique phenomenon that so many of us are experiencing, that even as physicians, we're kind of, we're learning a little bit as we go along, but trying to make up a lot of the deficits by being increasingly vigilant, increasingly aware. And you're absolutely right. I think when this first started, and it was emanating largely out of Hubei province and China,
Mm-hmm.
there was very little in the way of spread outside of China. And the hope was that this managed to be contained within China, or at least parts of Southeast Asia, that it was maybe not necessarily plausible or very likely scenario that it would escalate to other parts of the world. I don't think anybody would have fathomed that the catastrophe that's unfolding in Italy would have taken place, or that what we're seeing in the United States, particularly in New York City, is something we could have imagined happening this quickly. I would say that certainly after we started to see things unfolding as dramatically and as catastrophically as they did in Italy, it was a pretty big wake-up sign to much of the Western world, to the developed world, if you will, that this is not going to be a situation that is going to be confined to one region, and that it's not going to be a situation that is confined to a region with poor health infrastructure. Mm-hmm. Italy has excellent health infrastructure. 2 or 3 months ago, if you were in need of urgent medical care for some reason, and you found yourself in Italy, you would get reliable medical care and you wouldn't have to worry about that. Look how quickly things have changed. The healthcare system there has completely collapsed under the pressure of the pandemic there, and the system has really fallen apart, and the situation has become dire. I think a lot of physicians in North America, myself included, when we started witnessing this, we realized that this was going to be an imminent threat that was not only going to be unavoidable here in Canada and the rest of North America, but it was one we had to take much more seriously. I think once we came to that realization, the push for public policy to become more restrictive with respect to travel, with respect to physical distancing and some other measures became much more robust. The message became much louder and much clearer, and I think became much more unanimous amongst most healthcare professionals. And I hope that that continues and we don't let up anytime soon if we're going to get through this successfully.
Definitely. Yeah, that makes a lot of sense. And it speaks to, the fact that we sort of, as a general public, don't really, it doesn't really resonate with us that, this stuff is going to take a very serious toll on the next few months of our personal lives until it actually happens. It kind of resembles to me something like climate change, for example. It's going to happen eventually, but right now we can't really be in shock about it naturally because it's not right in front of us.
Yeah, and I think it's quite fascinating when you look at what's evolving here with the pandemic. You know, there's sort of two parallel issues, if you will. One is, you know, all of the problems that were kind of relevant to, you know, human hygiene, transmission of communicable disease, you know, and our overindulgence and our overuse of a lot of things that existed way before this. And this has really given us pause to reflect on our habits in terms of hand washing, in terms of our, you know, recognition of the fact that it's important to stay away from groups and public places when you're not well. That includes the workplace. It includes taking special care to recognize that elderly people and people whose immune systems are compromised for any reason need particular support and extra care when it comes to preventing them from falling ill to communicable diseases. You know, I think these are principles we should have known and understood before a pandemic. Unfortunately, it has taken the pandemic to bring those principles to mind and to make people recognize them with a greater level of vigilance. I hope that that's a good thing that comes out of this. You know, however, you look at the other issue. The other issue is the fact that, you know, leaving the principles aside, we're dealing with something that's spreading very rapidly. We're dealing with something that is spreading somewhat insidiously because there are a lot of people out there who have only minimal symptoms that can't be distinguished from a simple cold or may be entirely asymptomatic. And the fact that the disease is spreading through these sources is of great concern. And that's something that really needs to be acknowledged, understood by everyone so that they recognize just how serious this is. And I think that that message is still taking time to sink in, particularly when we talk about, you know, young people who by nature, I think are very social, you know, especially when school is not out and there is a tendency to recognize that the need to be engaged in group activities and to socialize in communal settings is just second nature. And I get that. And I think a lot of people have that natural instinct. We're as a society and as a species communal. And that's good. And normally it supports our ability to get through difficult times. But this is a unique exception where being together presents a really serious threat to having this pandemic continue to spiral out of control. I really wish people would understand that it's not innocent when they're meeting in small groups or meeting, you know, 6 or 7 feet apart in parking lots. It's dangerous. It's setting a bad example. It's setting a bad precedent for what lies ahead if we take this too lightly.
Definitely, 100%. Yeah, and as you said, it's pretty sad that it takes a pandemic for everyone to realize, you know, these basic rules of communicable disease and healthcare, and even for myself. And so, moving on from that, I wanted like something that you know, after hearing about this COVID-19 pandemic, and after, you know, being a part of it and being in the midst of it, people are you know, looking for resemblances in other events that sort of resemble this pandemic, and people often look to SARS, even though I don't believe it was a pandemic. Which brings me to my question: like, why and how has this pandemic been more impactful and widespread than something like SARS? Does it have to do with, you know, how we initially handled both events, or does it relate more to the nature of each disease rather?
Yeah, that's a very good point. And unfortunately, the virus itself shares part of the same name. And I say unfortunately because really, apart from both being coronaviruses and both being viruses that were originally believed to have been sourced from bats and then later transmitted to humans, and both originally identified in China, The similarities kind of end after that. SARS just didn't seem to be anywhere nearly as transmissible as COVID-19, which is a good thing because SARS seemed to be rather unpredictable in terms of who it might affect. And when it did, it could affect them with a really unrelenting lethality, which is why we saw case fatality rates in the neighborhood of 10% with SARS. So thankfully, it was limited to parts of China and Canada, and we didn't see anywhere near the same death toll that we're seeing now with COVID-19.
Mm-hmm.
COVID-19 seems to be another animal altogether, even though we still believe it likely did come from a bat. It seems to have mutated in a way that constitutes a much more transmissible entity and has made it very difficult to recognize because it tends to have a much broader range of clinical manifestations. People with SARS didn't present with no symptoms or a little bit of runny nose or cold-like symptoms or minimal flu-like symptoms. Most people who had SARS were fairly ill. They could recognize that they had been affected by something unusual, or frankly, were critically unwell or were in hospital, clinging to life. This is an entirely different scenario altogether, where we're dealing with a very, very broad spectrum, many, many different faces of a disease. And so when you're dealing with that and you're dealing with something that spreads very rapidly, it's extremely challenging to get it under control and very easy for it to spread through multiple communities, through multiple channels. And that's why this is really such a big concern and such a big threat. I think I would liken this more to the flu pandemic of 1918 than I would to SARS in 2003, just because of the scope, the extent of spread, and sadly, because of what it's done on a societal level on so many other fronts, whether you're talking about social isolation, economic despair, mental health, distress and difficulties that arise from the need to shut down so many public institutions and to create so many restrictions in terms of people's lifestyles.
Yeah, that makes a lot of sense, and it's pretty shocking how quickly things escalated, just within the month of March. And so, another thing that has been affected by this, from my understanding, is just regular inpatient appointments and matters of healthcare other than COVID-19 patients. And I wonder, in the coming months or a year until a vaccine is, produced, manufactured, and distributed, like, will the healthcare system be able to handle non-COVID-19 patients? For example, someone needing a regular, routine scheduled surgery next month or in the coming months. How will that change specifically from your opinion?
Yeah, that's something that has been talked about extensively. And really what has evolved during this pandemic is a need to prioritize things in a very extreme and streamlined fashion. So put simply, anything that is non-urgent has been canceled. Somebody who has been waiting for a hip replacement or a knee replacement and has been waiting for a year and a half, unfortunately, is going to end up waiting much longer if their surgery had been planned for it at any time in the next 3 months. That's just a reality of what we're dealing with right now. Anything that's non-urgent just simply can be expected not to be facilitated anytime soon. Now, that doesn't mean that whole segments of our patient base are being entirely neglected. What it means is we are certainly reducing the schedule and frequency of clinic visits. As you may or may not know, most assessments are now done either by video conferencing or by phone, so that there's actually no physical clinic or patients who do not actually need to be physically assessed. And that has been done with a moderate amount of success in most institutions, and I would expect that it should continue. I guess what worries me more about non-COVID issues is if our healthcare system is pushed to a level that is bordering on beyond capacity, what I worry about is the patients who come into an emergency room with heart failure, or who come in with severe shortness of breath that's unrelated to COVID-19, or have some other trauma or some issue. And if our healthcare resources are so stretched because we are so focused on COVID-19, and our human power is diminished as a result of that, it's difficult to fathom how those patients won't somehow suffer, how our response times would still be optimal if all our resources are being diverted towards managing a crisis that continues unsuppressed. That's a very real concern that I think is shared across the healthcare industry, in hospitals and clinics, that we don't want to ignore the fact that there's a lot of health concerns that exist outside of COVID-19.
Yeah,
some
definitely.
of which are going to be pressing and unavoidable in terms of meeting. And it would just be tragic if we can't meet those concerns and address those issues because of resource capacity.
Definitely, and it's a scary thought, because it doesn't, like, clearly this isn't going to end anytime soon. It's a scary thought that the healthcare system will become overwhelmed and won't have the capacity for non-COVID-19 matters. And it speaks to how the urgency behind flattening the curve, as many people are referring to it, and abiding by these quarantine laws and regulations. But so in theory, or ideally, how long do you think that'll take, or how long do you think it'll be in North America and Canada, at least, for us to reach a growth rate of new cases per day similar to what China is experiencing right now, and how China has been able to reduce that number greatly?
So if I had $1 for every time I was asked that, I could probably retire fairly soon, and it's understandable. I think the truthful answer is we don't know for sure, but I know that that's not very satisfying to most people.
Mm-hmm.
So unpacking it, when we look at the math and we look at what we're seeing right now, we are experiencing what's called exponential growth, which means that we're going to see, doubling of cases. We're going to see a rapid increase in cases in these rather big incremental surges. And, we had over 400 cases in Ontario today alone, which is unprecedented.
Yeah.
I wouldn't be surprised if we saw 800 cases that were all reported in one day in a few days. As long as that's continuing, it's going to be very difficult to say how long it's going to take. But looking at math and looking at projections, I would say that realistically, this is going to go on for at least another few weeks. We are not really going to be in a position to determine if we're getting to the point where we can think that we're actually flattening the curve until at least the end of April, potentially sometime in May. And I think that really highlights the importance of people not becoming complacent about this. And I think really one good thing that will come out of all of this is really our attention to health literacy and our ability to understand where we should go for resources, how we should learn about taking care of ourselves, where we should seek help. And, prior to all this happening, I think most people were fairly liberal with their use of urgent care clinics. They were fairly liberal even with their use of emergency rooms for issues that truly weren't urgent in nature. And it was almost as though, our system was available, and therefore, if the doors were open, it meant it was okay for you to trudge out to any one of these areas and, utilize healthcare resources. And, if anything, maybe this is an opportunity to really determine for ourselves how judicious we need to be. What can we do for ourselves to learn about our own health, learn about what we can do in our own homes, learn about consultation advice we can get without actually going into an emergency room in particular. This is a chronic problem, and it has been at crisis proportions for decades, and it needs to be addressed. And I'm hopeful that one of the lessons we can learn from this pandemic is to recognize that the system is not limitless in terms of what it can afford, either on a monetary basis or on a human resources basis. And the sooner we become a little bit more self-sufficient and knowledgeable and manage our health literacy better, the better it's going to be for us as a society as a whole. I don't want people to think that they need to become their own doctors. I'm not saying that. I'm not saying to ignore your fever and, say that this was a recommendation that Dr. Sharkawy had. There's certainly no truth behind that. But I think it's an opportunity to take stock of what we can do for ourselves, how we can become more aware and educated and improve our lifestyle habits so that we don't have to burden the healthcare system more than we're doing at present.
Yeah, that's a really good point, and it's it tells us at least there's a lesson throughout all of this. And you spoke about how after this pandemic will be a lot of people will start to implement these changes and start to be more considerate of the capacity of the healthcare system. But do you think on the other end of things we'll see systematic changes to the healthcare system in terms of how it how doctors or institutions distribute or provide their healthcare after the pandemic?
That's a great question, and I think we might have to. I guess part of the concern is going to have to emanate from the fact that this is going to use up an enormous amount of healthcare expenditure. It's going to tax our system dramatically, and I think it's going to have to necessarily reframe how we utilize resources and what we determine in terms of prioritizing care. I think that's going to be a reality. I think we were headed there well before this pandemic, but this has certainly sharpened our focus, and maybe it's putting the lens on a little bit more clearly to accelerate what was already being strategized much more quickly.
Yeah, definitely, and I agree with you because I agree with you in what you just said, because I feel like we're seeing a lot of acceleration in other spaces and other fields in terms of in other fields we see situations where we sort of know where we're headed, but a lot of things that are transpiring within the past few weeks are sort of accelerating that trajectory.
Yeah, and it's teaching us about where, for example, we can use technology more to our advantage, what we can do by the way of virtual interfaces. Again, these are not novel concepts. We all know that AI is becoming, the buzzword of this decade, and there have been movements afoot, especially in radiology, towards changing protocols and doing a lot of other things that can maybe make the healthcare system and our ability to manage patients more efficient and more cost effective. I think we can expect to see more of an emphasis on that as a result of what we're seeing here. There's no question about it. And that's maybe a good thing. The system as it exists right now is not sustainable in terms of the burden and intensity of work that it places on healthcare providers. It's not sustainable from the point of view of the amount of resources and expenditure that go into pretty much every aspect of hospital care, out of hospital care, etc. So anything that's going to help us re-strategize and look at more efficient ways to use systems that don't involve hands-on care and assessments is going to be considered much more seriously, and hopefully we'll learn a lot coming through that.
Definitely. That does make a lot of sense. And sort of on a separate note, we're seeing that a lot of people are realizing how much effort and dedication doctors are have to commit towards their daily life right now because of the pandemic. So I'm wondering, from your perspective, or even your colleagues or people, what's sort of your daily routine? What does that resemble right now? I know it's crazy and very unpredictable. But I was wondering if you could shed a bit of light on that.
Sure. So, I mean, my routine is a little bit unique because I'm in a bit of a strange situation right now, as I've assumed a larger media role than I could have anticipated happening, a few short weeks ago. But certainly, a lot of my colleagues are in the same boat in terms of the level of preoccupation we have with this, the amount of discourse and dialogue that's occurring with great frequency in terms of meetings, in terms of preparedness, in terms of assessment of where situations are getting better or worse within our hospitals, within our clinics. I work in an academic institution, so we're constantly assessing where our students and our medical residents are in terms of their experience and the level of support they're getting through this difficult time. We're all preoccupied about our protective equipment and concerned about our ability to manage a supply of that as this evolves. And a lot of us are doing an enormous amount of work from a consultation point of view for other healthcare organizations, for the media, for the public at large in terms of education and health promotion. It's a 24-hour job, and that sounds like a bit of a cliche, but it's not far from the truth.
Yeah.
From the moment I get up to pretty much the moment I go to sleep at night, my phone is abuzz with messages and requests and all kinds of demands on my time, and it's difficult. It's difficult to decline a lot of it because I have a real sense of duty and obligation to help as much as I can with whatever expertise and support I can offer. And I know that there are others doing far more than I am. I couldn't be more proud and more grateful and appreciative of anyone's efforts to help during this really unique time. It's overwhelming for most of us, and giving any measure of support and sharing any form of compassion and kindness with one another really goes a long way, and hopefully will be the guiding principle behind what actually gets us through this successfully.
Mm-hmm. And I'm certain a lot of people are grateful for all the efforts you just mentioned. Not only that you're taking part in, but also your colleagues and the whole community of doctors right now in this unique time. And that being said, I really want to thank you for not only taking the time out of your day to come onto the podcast, but to also shed light on your insights and what we really should be paying attention to during this really unique time. So thank you for that.
It's a pleasure. Thank you so much for having me.
Art of Impact is co-hosted by myself, Talal Fahoun, and Angad Aneja. Behind production and occasional co-host is Tate Claggett. Our director of marketing is Max Bayevsky, and our music is produced by Pranav Vaidyanathan. Thank you for listening, and see you soon.